Good morning. How's everybody doing today? So good to see everybody. We're just trying to give everybody a couple minutes just to hop on here. But I'm really excited. It's been a while since we did one of our webinars, and so it's time to bring it back. Um, I am excited to introduce some new locations that we're opening with for thermography. We have our village midwife, Amanda Cini, who will be joining us and introducing herself at the end of the webinar as well in Babylon, the most adorable place ever. And then cleansing concepts. Vanessa won't be able to join us. She might join us at the very end, but her location in Garden City, we're going to talk about all the different locations at the end of the webinar. And then Surrey Wellness, which is where I personally get my massages, and all our locations are amazing. We're really excited to introduce you guys to these new locations for thermography. So let me just make sure I have a waiting room up here. So if I seem distracted at all, it's because I have to admit people in the waiting room. So I don't want to leave anybody sitting in a waiting room. So just so you guys know, let's see here. Okay, so let's get started. So we have, let's see here. Okay, so we have some new people here today. So I was like to just kind of introduce myself to the new people because you may not even know who I am. I took kind of the long and winding road through medicine. I started off in emergency medicine and as an EMT, a paramedic, trauma technologist, PA. I worked in surgery and critical care for many years. And probably the biggest question I ever get is what got you into holistic medicine. And it was my family. It was most people, I think, in this field have a personal story or a personal calling. They either got sick themselves or a loved one got sick and they went searching for answers. And that's my story. My sister-in-law was diagnosed with cancer, and I started reading every book I could get my hands on, desperately trying to help save her life. And when I read all of this about holistic medicine and holistic cancer care and preventative medicine, and I learned about nutrition and stress and that emotions have the power to make you sick, it kind of blew me away because that had not been part of my conventional training in any way, shape, or form. And so I became then a student of holistic medicine and really just delved into all the different aspects of preventative medicine and really kind of thinking about root causes, why someone is sick, and then how to help them heal and get better. And so, integrative medicine is just looking at the whole person. It's really just looking for the root cause. It's thinking about mind, body, spirit. It's really getting to know what might be out of balance and helping that patient find the right recipe to optimize their health and their well-being. And that's really, truly what our whole practice is focused on. I don't fix people anymore. I help them heal. And so thermography is a crucial part of my practice. I started with thermography over 10 years ago, and it's a phenomenal tool. I was then in medical school, and I was recruited by my professor to do my PhD in thermography because he was a physicist and he was very passionate. He had helped him self-heal himself, with prostate cancer. And he was like, you have to do your PhD with me. And so that's how I embarked on my research in thermography. And we're going to talk all about that today. I'm going to present the data and present the research and really delve into all of that. So thermography has been around forever. People are very surprised. A lot of people have never heard of it, but it's really been around since the dawn of mammogram, to be honest with you. It's been slowly introduced and probably not as well accepted because number one, it is not yet covered by insurance. And so that immediately kind of stalls the acceptance and the research behind it. And number two, the biggest criticism of thermography is that we find things too early. In my conventional training, it was about diagnosing and treating. You do the test, you find the problem, you treat the patient with medicine or surgery or radiation or whatever our tools are. For integrative medicine, we're looking to find things before it's a problem, right? We're looking to find symptoms and patterns to help a patient to prevent illness. And then if they are ill, to help them find the tools to get better. And so thermography, preventative medicine is not accepted in medicine or insurance at all. In fact, there's a Medicare guideline that says they will not cover anything that has to do with prevention of of disease. So it's an uphill battle, but I believe we are making progress, and it's research like this that is going to make the difference. But you can see from this slide, it's been around a long time, and it's not something that is new. My passion, my goal is to get this into offices all around the country. And that's why we're starting on Long Island, but because it is such a powerful tool for diagnosis, for treatment, for helping people heal. So it's non-invasive. There's no radiation. It's literally just taking a picture, right? Taking an image. It's more of a test of physiology. So the tests we're comfortable with that we know about are, ultrasound and mammograms and MRIs and CAT scans. Those are tests of anatomy, right? So they're looking for the organ, the size of the organ, is there a mass, the size of the mass, where is the mass? It's much more of a test of anatomy. This is more of a test of function, right? Physiology is the body's function. How well is the body functioning? There are very few tests that have the ability to tell that to a practitioner. So that's why I believe it is so positive and helpful, is that I want to know how the body's functioning to help you function better. And that's functional medicine, right? That's the foundation of functional medicine. It's valuable as an adjuvant or an initial screening, but it is not a standalone test. It is not it's not designed to take the place of additional tests, right? You can't just get thermographies and never have another test. And we'll talk all about that. But if there's a finding on thermography, it can require additional tests. Physical exam is never excluded. You always have to examine. Self-examination is very important with breast health, as well as going for your breast exams, which you can now go to Amanda for every year. It's 100% safe, right? It is highly sensitive. We sometimes see things before the patient even feels them. And I'll show you some examples of that. It's pain-free and it's cost-effective. So thermography is just a camera. And if you've been to our office, Deanna is on. Give us a little wave, Deanna. Deanna is our certified technician who's taking our images, and she, uses the camera, places you in a location, has you change, hands up to the side, and we get to get these images, which then get downloaded into the software. We use one of the best cameras available. It's a German company, FLIR. They're world renowned, and I believe they have the best technology. And we'll talk a little bit about our software too, that helps us present the information to the patients in a tangible way that they can actually see. It's state of the art. If you've had thermographies at other locations, a lot of patients will come and they'll show me pictures from their last thermography. And it's like night and day. I mean, the technology that we have is state of the art and really gives us a tremendous amount of information. The software is Total Vision. Carol Chandler is the owner of the company. I think she is a pioneer in this field, and probably one of the biggest reasons it's as popular as it is. All of our technicians are certified. And then I choose to upload these images to a radiology service so that we have objective, trained radiology physicians who are trained in thermography giving us an official report. And a lot of doctors' offices are not doing that, but I think that that's very important to keep standards in the field. And it's not just breast. Everybody thinks about thermography for breast thermography. It's probably the biggest reason people come to us, but we can see everything, right? We can see head and neck, we can see sinus inflammation, we can see evidence of TMJ, dental abscesses. I've picked up probably a dozen dental abscesses the patients didn't even know they had, which is a chronic festering drain on their immune system and becomes very, very detrimental. And we see it very easily on the thermography. We can see the carotid artery inflammation at like 5 or 10%. The conventional tests are looking at, is it less than 50%? Then that's normal. You don't want to have 50% blockage before you find out about it. Neck pain, pain and inflammation in the neck. Breast, obviously, we can see lymphatic congestion, dilated ducts, evidence of hormonal imbalance, generalized inflammation. Chest, we can see acid reflux very well. A lot of times people have silent acid reflux. They don't even know they have it, and we can see it and tell them, hey, maybe some things you're eating is causing this acid reflux and you need to do something about it. Heart, chest, lungs, anterior shoulders, upper back. We can see strain, injury. We can see evidence of chronic stress. The abdomen is amazing. We can see so much related to gut health, leaky gut. Is there congestion in the liver, potentially suggesting toxicity? Female organs, lower back. Obviously, I'm seeing this. I'm calling it a covert lower back pattern because everybody's sitting at home working in these not good office chairs, and we're seeing these patterns that are completely suggestive of you need to get a new chair. So this is just kind of an idea. We do full body, we do women's health, men's health, which is basically, everything important in the organs and not the extremities. If people have joint issues, we recommend the full body. But you can see this is the carotid arteries. We're seeing a little inflammation in this person. We've got a lot of spinal inflammation in the spine. We've got some neck inflammation up in here. This is a great picture of leaky gut, just sort of seeing the small bowel loops pointing at the camera with all that inflammation. And it's a little caught off at the end here, but we can see phlebitis in the legs as well. So we can see increased inflammatory patterns. The body should be symmetrical, right? So in physical exam, in our training, we're looking for symmetry. And when something's asymmetrical, it may indicate that there's an imbalance or an issue. So it looks at inflammation. We compare left to right. We're looking for cold spots, hot spots, patterns of congestion. We can see headaches, dental infections, joint pain. Very commonly, I'll do the reading, I'll look at the report and I said, did you happen to have a headache that day? And they're like, yeah, because it shows up right in the report that they're getting. Sometimes I didn't get a headache till I went home that day. We already saw it on the thermography brewing. Fibrocystic breast disease, patterns of neovascularity, which we'll get into, but that's new blood vessels going to an area, lymphatic congestion, like we talked about, the vascular congestion. Cold spots actually suggest hypofunctioning. So let's say, for example, someone has hypothyroidism. We'll see a cold spot right over that thyroid, might suggest that patient is not on the appropriate amount of medication, or maybe they need to go get blood tests done and they might not even know they have hypothyroidism. Food sensitivities, autoimmune disease. We can actually see a pattern that suggests the patient is completely stressed out, showing their adrenals are deficient. And I don't know of another test truly that shows that you're stressed out. And stress is big, and the neurologic system, the endocrine system, the immune system, they're all reflective in the skin, which is how we can see this on our thermography images. So like, this is a neat example of lymphatic congestion. And when we're showing the patients, we can put these overlays over their images and show them like, hey, your lymphatics run right down the abdomen here. Your lymphatics run right under your arms, and we've got a lot of congestion here. And lymphatics is your plumbing. It's taking out the trash. It's taking, it's your super highway in your body. How do your white blood cells get new infection? How do your body get rid of toxins? If your body is congested from a lymphatic standpoint, it's potential for a problem. And things like lymphatic drainage and massage and exercise, these are all things that patients need to know. They can really help their bodies do those functions better. Estrogen dominance is a big issue in the environment in the United States. I talk a lot about this when I talk about toxicity in our detox programs, but most women in the United States have this estrogen dominance, where they're getting symptoms like PMS, breast tenderness, cramps. All those symptoms they're not normal. They're signs that the body is out of balance, that the estrogens are dominant. Now, why do we care so much about that? Yes, we don't want our women suffering every month before their periods, but I'm more concerned about that chronic every month, the estrogens going out throughout a lifetime definitely put the breast at risk. So that's something, when we see this pattern, we can say, hey, what's going on with your periods? How long has it been going on? And we can give them things to balance that back out, thus keeping the breast safer. Food intolerances are major. Leaky gut is the foundation of the whole body. It's where all your immune system is. It's where you absorb all your nutrients. It's where most of your neurochemicals are. And so, a lot of the things that bring people to me start with leaky gut. And so when I can see that on the picture, it really helps us kind of go, okay, what are you eating? What are your symptoms? Are you bloated? How's your bowel movements? And really kind of delve in there and figure out what's causing all of that. It's interesting. We don't have enough data to really know what COVID looks like on thermography yet, but this is the pattern that we're seeing in patients that have had COVID. It's, on X-ray, it's sort of this ground glass opacity is what we call it. And it kind of, on thermography, it looks like somebody had been a three pack a day smoker. We're actually looking for a few candidates to who have had COVID, who maybe have some residual lung symptoms, whether it's shortness of breath. A lot of patients are complaining when they exercise, they're just not getting air like they used to, and a kind of residual shortness of breath. We're looking for a few candidates to take a thermography, see the pattern, and then treat them with nebulized glutathione to see if we can get those patterns to go away. And so if anybody knows anybody, kind of keep that in the back of your mind. We are also looking for a few candidates who happen to be getting the COVID vaccine, if they would be open to coming and doing an image and then coming back a few days after the vaccine. We're trying to see what the pattern looks like on thermography after the vaccine, because we know that in mammograms, they're seeing tons of inflammation on the mammogram after the vaccine. And so this is new findings, right? These are new things that we really need to get a few people to show us the patterns so that we know how to treat them and we know how to identify them moving forward. And when we see this, we obviously recommend our anti-inflammatory oils, deep breaths, and like I said, nebulized glutathione, sometimes nebulized steroids. So my research, right? So the reason that I got thermography in the first place was that, I practice on Long Island, and there is a huge amount of breast cancer. And I spent the first 5 years of my career taking care of, that was my passion, was holistic cancer care. So I was obviously attracted in a lot of women that had been recently diagnosed or recently treated with breast cancer. And the first few years of integrative medicine, you spend a lot of time in books and researching. And every time you encounter a patient, you go searching for the answers for that patient. You still do that because it's constantly changing. The data is constantly evolving and you're constantly looking for the best tools for your patients. So in my search for helping my patients with breast cancer is how I formulated my preventative program, right? Because the root cause means a lot of things, I would say a lot of dominoes have to fall for cancer to take hold of a body. And so when you think about breast cancer and you look at the research, there are very formative things that we know play a part in that, right? And we're going to talk about each individual one. When I think about the root cause of breast cancer, I try to think about solutions to that. So inflammation, right? Toxicity, low vitamin D, stress. These are all things that we know come into play when someone is diagnosed. And so those are the things that built up our prevention protocol that we implement when we do our thermographies. And we're going to talk very detailed about all of that. So vitamin D is getting a lot of press, a lot of press this year because of COVID. People in integrative medicine have been talking about vitamin D for decades. Vitamin D is so important it's a pre-hormone. It's an immune booster. The data has been clear. New England Journal of Medicine has been talking about vitamin D for decades and how important it is in preventing cancer, in reducing recurrence, and in improving outcomes, in that we know that it diminishes risk for death once you've been diagnosed with cancer, right? So vitamin D is crucial. We are going to talk a lot about it. You guys are going to know exactly what's going on with vitamin D. Iodine is just not in the American diet. Iodine deficiency leads to this fibrocystic breast that we're seeing, and can be easily reversed. Our breast roll-on is sacred frankincense, which we're going to talk about a lot. It's anti-inflammatory, it's anti-cancer, anti-inflammatory diet, natural deodorants, right? Really not good to be putting aluminum right next to our breasts. So we really encourage women to just take those little steps of minimizing their exposure to toxins. Exercise, super important, and the data is clear. Dry brushing, lymphatic drainage, like we were talking about, lymphatic drainage, massage, exercise. We give out these little dry brushes that women can do to help themselves on a daily basis. Serial thermography, I'm going to talk a little bit about that. A lot of women have come to me and they went for thermography like 10 years ago, and they'll bring me these images. And I always have to go above and beyond to sort of educate patients that thermography, the beauty of thermography is in the comparison. One thermography is kind of useless. You need to have your initial to implement a program that's going to make a change in the breast, and you need to do another image and make sure that you've gotten the result. You've gotten an improvement in the breast. And then once you have your baseline, that once a year thermography, make sure that we're still moving in the right direction, right? And make sure that there's been not any new patterns that look suspicious. One thermography is not enough. You have to do serial thermographies, twice to get your baseline, and then once a year to make sure that you're staying in a safe area. Stress relief is essential, and detox. Well, we're not going to get in depth into detox today because it's a whole lecture in and of itself, but it is really important to get rid of the toxins we've been exposed to younger on in life. And so, this is a test for both men and women. Most women, I would say majority women, come for thermography because they're mostly worried about their breasts. But this is going to tell us a ton about men too. Do you have heartburn? Do you have leaky gut? Do you have joint inflammation that shows up years before a autoimmune disease? Is there signs of carotid inflammation? These are very helpful patterns for both men and women. And we want to stratify the risk. So low vitamin D has absolutely been shown to be an independent risk factor for prostate cancer, breast cancer, and colon cancer. Now, I believe it is involved in all cancers, but those are the three that has the most studies. And prostate and breast are very similar. So if you come to me as a patient and you tell me your grandfather had prostate cancer, my spidey senses are up and I'm thinking breast health for you. Okay. So there's a lot of commonality between prostate cancer and breast cancer. And so that's something that we think about. Fibrocystic breast tissue is not normal. Okay. It is common in the American women, but it is not normal and can be reversed. Neovascularity is with the pattern we see on thermography, which is like new blood vessels coming to an area. So when we see, and I'll show you a couple examples later on in the presentation, a little circular pattern, I worry that that's a blood vessel feeding precancer cells or cancer cells in the middle, right? So that would be our most suspicious sign on a thermography, is that little blood vessel pattern, which I'll show you. And we call that neovascularity, lymphatic congestion, subjective hormonal symptoms. Now, I incorporated in genetic testing in my PhD research because I do believe very strongly that toxins are a major contributor to cancer. And when we look at MTHFR, which I'll explain a little bit, it's a gene, patients, we can kind of predict who's going to not be a good detoxer and who's going to be a better detoxer. And that kind of helps stratify risk for me as a practitioner. So MTHFR, we're going to talk a little bit about in the future slides. These are the things I tested for on the initial exam, right? So we did MTHFR mutation, we did vitamin D levels to see where they were. We did a lifestyle assessment, talking a little bit about diet, stress, and then we did our initial thermography. We then brought them back in, we put them on our protocol. We brought them back in 3 months and a year, and we did another thermography, another questionnaire, we did another blood test, and we got to see, and I'm going to present all that data at the end of the presentation, where women started, where they ended, and then we actually have the before and afters for the study participants as well. Then we implement vitamin D. Are you taking vitamin D? Are you taking enough vitamin D? And we'll talk a little bit about that. Lugol's iodine, we do a topical application as well as an oral application, as long as women don't have any history of thyroid autoimmune disease like Hashimoto's or Graves' disease. We do a breast roll-on, which is the frankincense we talked about. We teach them how to do a breast exam, and then we talk about stress relief, right? So that was the protocol we used in the study. Vitamin D, ideally, the most recent research suggests that your blood levels are between 80 and 100 to do the best at preventing cancer. I would say above 50 is decent. So anybody who's above 50, everybody should be getting vitamin D checked to make sure that you're in a low risk category for COVID this year. There's a lot of companies coming out with home tests for vitamin D. Of course, we can't do them in New York yet, but you can do them every other state in the nation. It's a little bit of an issue with New York and tests, but it's something that I would say most people today are taking vitamin D because of COVID, much more than I used to see before, right, Deanna? I feel like most people are saying, yeah, I'm taking it, but I would say they're underdosed. They're not taking enough, and they've never even known to take their blood levels. The issue with vitamin D is you used to get it from the sun. That's what the sun is designed to do, is hit our skin and turn into vitamin D and boost our immune system. That's why people get sick less in the summer, and people feel better. Their mood is better in the summer. And what I found over the last 10 years is that pollution has really made a big difference in the ability of the sun to get to our skin to make that vitamin D. So over the last 10 years, I watched everybody's serum levels go down, down, down. And it was like people who were in the sun, they were spending, winters in Florida, and I was scratching my head. And my working theory was that pollution was the cause, right? So there's so much pollution. Everybody's gone into New York City on a hot day and there's a cloud. You could see that dome over the city, right? Well, that filter is keeping the sun from getting through, right? And so the sun is not the same quality that it was when we were kids, right? We could count on the sun to get our vitamin D. Now, I would say in the last definitely 8 years, you really depended on the pills. And this was, again, a working theory. This was the only study, when I had this theory, the only study I could find out there that showed that pollution was reducing vitamin D levels in polluted cities in Iran in children. That was the only study. When COVID hit, we were doing webinars every week, and I was saying, we were locked in for 4 months. There was no planes, no trains, no factories open, and the world was allowed to breathe, right? And the pollution cleared. And for the first time ever in 10 years, I had to call like 25 people in a row to tell them that their blood level for vitamin D was too high. Never seen that in 15 years of doing this. So what happened? We were in the sun and the sky was clear, and our body was able to do what nature intended, which was get vitamin D from the sun. So that is still pretty good. I can definitely say I'm still seeing evidence of people being much higher than normal if they're out in the sun, but it's starting to decrease. So like, how long does it take for the pollution to go in there and make that damage? I don't know, but I definitely think this summer was the first time that people got vitamin D from the sun. I think that definitely contributed, besides the hand sanitizers and the masks, to the basically no flu that we had this season in New York. But it's very interesting to make those observations and kind of see what's happening. And there are tons of studies about vitamin D. I will make this PowerPoint available to you guys after. I don't want to waste a lot of time going through the individual studies, but I just went through and added a bunch of studies related to breast cancer. And I could have 6 pages of studies on this particular topic, but we know with certainty that low vitamin D increases risk for breast cancer, increases risks for breast cancer recurrence, and increases risk for death from cancer. So, and a really good article I just read yesterday, a study came out, and I wasn't able to put it in the presentation because it was late in the day, but I will send that out to you guys as well. But it's really solid data, and it's absolutely, without a doubt, very important to have your vitamin D levels checked. Iodine is the other nutrient that we added to the protocol because iodine reduces fibrocystic breasts, right? So I went to a conference early on in my career with Jonathan Wright, and he is phenomenal. I highly recommend you guys look him up and look at he's got a book, he's got a website, but Jonathan Wright did the most research in iodine for fibrocystic breasts. And at this particular conference I went to, he had told me about the doctor that taught him about it. He invited 100 doctors to a conference to bring 2 patients each. So they had 200 women with the worst case of fibrocystic breast that they'd found. And sounds crazy, but they all examined these women's breasts and kind of got a baseline. They took them into the next room. They had nurses who would apply Lugol's iodine to the vaginal canal, right? So they actually took a swab and applied iodine to the vaginal canal. And then they actually gave them a little push of magnesium because magnesium dilates blood vessels. So his thought was that magnesium, get the iodine to the ovaries, and you'll see the biggest change in the breast. They brought these women back into the next room. They examined their breasts. There was a notable change on their physical exam after 1 treatment. He then told these doctors to take these women home and treat them for 6 weeks and then give him the feedback and the data. And pretty much all of the fibrocystic cases were significantly reduced, if not resolved completely. So we don't do vaginal swabbing with every patient. We do topical application, right? I want women to be able to go home and treat themselves. So we have them apply a little spot, quarter-size spot on the breast, twice a week. That's all it takes. And then if they don't have any thyroid issues, they can put a little bit in water and just drink it. A couple drops of water. I do it before I brush my teeth at night. I'm getting a dietary dose of iodine, right? Slow and steady with iodine. If you do a lot of iodine very quickly, you're going to get your thyroid to bump off all the toxins that are attached, and it's not going to go well. So you always want to go slow and steady with iodine, and slowly but surely, every 3-month follow-up we see a reduction in fibrocystic breast conditions on thermography. It's quite powerful. The issue is that there's not really a lot of iodine in the diet. And the things that do have iodine, like kelp and shellfish, you don't really want to be eating a ton of them because they're on the bottom of the ocean and they do have toxins associated with them. Listen, I still eat shrimp and I still eat lobster. I haven't given it up completely, but I eat it in moderation, and certainly I'm not able to eat the amount I need to get the right amount of iodine to keep my breast healthy. And these are the studies on iodine and breast health. Some of them are in vivo with a petri dish. Some of them are animal studies. Some of them are human studies, but they're really, really shown to reduce the risk of breast cancer as well as reduce fibrocystic density. And remember, that's going to make all of your tests more effective. Your own physical exam, I think that's I ask every woman, do you do a self-exam? I would say, if they're being honest, probably more than 50% say no, they don't do self-exam at home. And I always ask why. And the most common answer that I've gotten is, I don't know how. It's lumpy and it's bumpy and I scare myself every month and I don't want to be scared. So if you're reducing fibrocystic density in the breast, your self-exam is better. Your physician's exam is better. Your mammogram is going to be more effective. Your ultrasound is going to be more effective, right? So it improves all of our surveillance options. It's really, really key. I had a woman call me recently. She'd gone for a mammogram and the technician said, "Oh, you must be doing the iodine and the frankincense stuff." And she said, "Well, how do you know about that?" She goes, "Because everybody who comes for the repeat mammogram that I actually see improvement is doing this thing." So she called me all excited. I'm like, "Yay, it's getting out there." Even the technicians at the mammogram centers are noticing the difference. So our breast roll-on, I call it Love My Girls, because I think you have to give love to your girls every day. Love My Girls breast roll-on is a combination of sacred frankincense, and we dilute it with jojoba oil. I do it straight at home. You don't have to dilute it. The only reason I dilute it is because it makes it a little bit more cost effective, and women are much more likely to keep doing it if it's a little less expensive. But Boswellia sacra comes from a tree. It's the sap of a tree that's grown in the Middle East. It's frankincense that they, gave to Jesus in the Bible, right? The gold and frankincense and myrrh. It's very, very therapeutic. So if you look at ancient medicines, they pretty much have been using it forever. That's what they use to baptize babies. And they always said it would help their immune system. It's been around forever. It is not new, and it is incredibly effective for many different kinds of cancer, but specifically breast cancer. This is a couple of the different studies that were done on sacred frankincense. Specific to breast cancer. There are studies on breast cancer, pancreatic cancer, bladder cancer that I know of to date, but these are the bits of information they gathered from breast cancer. And I have women put this under their arm and around their breast once a day. It's in a little roll-on. I believe it's anti-inflammatory, anti-cancer, and it just positive too, right? So just give your girl some love, right? And again, I will send this to you. I don't like to read through all the data because it gets boring, but we know that it affects the P53 gene, and we know that has to do with cancer toxicity, as far as we believe that the frankincense actually induces cytotoxicity, which is cell death within breast cancer cells. And they've done a lot of, like I said, in vivo in the petri dish, as well as animal studies. We need more human studies, but how hard that is to get funded in the United States. But it's really, really powerful. And it's something that I've had people come for thermography like 8 years ago, and then they feel something in their breast and they come back and I'm like, "Okay, are you doing your protocol?" No. Why? Why stop doing a good thing? If you had a thermography that showed a suspicious pattern and you intervened with a protocol that made a difference and the pattern was gone, please don't stop. Please keep doing what you know is working. We live in Long Island. We are always at higher risk for breast cancer. I don't think we can just do this and do nothing, right? We have to be proactive. We have to implement change, and this works. And hopefully by this end of this presentation, you will be completely convinced of that. So breast self-exam, why not? I'm afraid, I don't know how, I'm not sure what I'm feeling for. It doesn't matter, right? Love your girls every month, not the week before your period. You feel your girls. You're going to get to know what's normal. There's no rules. When you know what you feel like, you will know the minute it doesn't feel normal. right? And that's really the big takeaway with breast exam. Get in there and just give your girl some love, and don't be afraid. It's not being afraid. You're telling them I love you and I don't want you to get sick, right? Mental mind body connection. I think it's very, very important for people to go into it with not a fear, but a positive outlook. This was a big study that was done where they looked over a 25-year period of time. Almost 50,000 women were screened. Who was screened with mammogram, who wasn't screened with mammogram. And what they found is that 505 women died who had been annual screened with mammograms, and 500 women died who were not screened with annual mammograms. And the big takeaway is mammograms are not saving lives, right? They are not changing the dynamic of the breast. They are not doing anything to prevent the disease itself. And that's something that we need to change, that dynamic for women, that they need to be proactive in their own healthcare. And it really is, this is the Preventative Medicine Task Force. This recommendation came out in 2009. It's not been adapted by the AMA, but, basically they suggested that women start from mammograms at age 50 and go till age 74. And that women between age 40 and 49 have a mammogram if in fact they have a family history or a very high risk for some reason, but that we should be doing mammograms every 2 years, right? And the reason that they came at this, they made a suggestion to change that age old, start at 40 and get one every single year, is that there are risks associated with mammogram. There are studies showing that the frequent radiation is potential for an issue, right? So, I have a lot of women as a family history. They started mammograms at 30 and they've been getting them every 6 months since then. That's a lot of radiation. So it's not that mammograms are causing the problem. It's that they're not the solution to the problem. And that we do have to kind of say, well, what else can we be doing? Now, if women start doing thermographies at 25, which is when I think they should do it, between 25 and 40, we are now, all these years of prevention, all these years of surveillance. We don't do anything until age 40, except for your annual exam, right? Where you go to your gynecologist. And if you're lucky, you're self-examining, but there's nothing going on during that time. Is a key spot for thermography, where you're going to get to know your breast and you're going to get a plan that will, get you preventing. And this woman, presented in front of Congress, but she said, we're getting sidetracked by the efforts of getting a woman every single mammogram. And we could screen every woman in the world, but we would not have stopped breast cancer. And not that mammograms aren't important or that the funding should stop, but we can't make that the main focus. We have to think about causes. We have to think about prevention. And 5% of research goes to the environmental causes of breast cancer. That's just simply not enough, because the causes are where we have the cure, right? I believe preventing the disease is the key. And if the research isn't going towards it, and we know that toxins are a factor, right? We know parabens. I used to put sunscreen on my babies, head to toe, 50 sunscreen. I was a sunscreen mom, and I was putting parabens all over my little girl's breasts, and I didn't know any better, right? We know parabens associated with breast cancer. I know better now, right? So if the data is not out there and the research isn't saying, hey, aluminum is bad for your breasts, switch to a natural deodorant, we're not getting this information out to women. We're not really going to reduce the numbers of breast cancer and prostate cancer and colon cancer. So we'll talk about toxins in another lecture in detail, but we know that parabens are associated with breast cancer for sure. We know that BPA is associated with breast cancer, and this study showed that it was as bad as DES. So DES was a medication we gave to women eons ago, and we had no idea that it would go on to cause reproductive cancers in their children and their grandchildren because they took that medication. This study shows in mice that BPA, which is in bottles and plastics and you're microwaving it, is as detrimental in the association of breast cancer as DES, right? So that is huge. So getting women to use glass, to not microwave and plastic, these are all part of the plan. They're all part of the prevention. And genes load the gun, but environment pulls the trigger, right? So I have the gene for diabetes. I know it with certainty. And if I don't eat sugar and I don't eat carbs and I exercise, I am not going to get diabetes, right? Same thing with toxins. If I know I'm not a good detoxer and I know that I have that MTHFR gene and I avoid toxins and I detox once a year and I take my B vitamins, I'm reducing my risk for the bad outcome, right? So genes, people are afraid a lot of times. They'll tell me, I'm afraid to get my genetics done. And I always say, why? And they say, because I'm just afraid what it's going to tell me. And never be afraid for that knowledge. That knowledge gives you the information to prevent disease, right? So all of my medical patients have been screened for MTHFR. It's the gene that helps you methylate your vitamins, right? It helps you methylate and detoxify. And if you have a mutation, it can make it hard for you to detox. So I always use my family. My dad's side, there was colon cancer, heart disease, autism, Alzheimer's, you name it, they had it. My mom's family lived 5 miles away and they smoked and drank until they were 80. Genetics, right? They lived in the same place, they were exposed to the same stuff, but genetics, if you know about the genetics, you can intervene. If you don't know, then you feel like a sitting duck, right? So there's two different genes. This is, I'm gonna earmuffs if you don't want to hear me curse, but this is the motherfucker gene, right? And once I say that, you'll never forget it. Never. You'll tell me 5 years from now, hey, remember I have that gene? There's two genes. There's the A gene and the C gene. You can get one mutation from one parent. You can get one of each. You can get the same one from your mom and dad, which is kind of like the double whammy when you're homozygous. Just means it's more important. It means instead of detoxing at 95%, maybe you're down around 85%, right? But there's things you can do about it. It's the genetics are just a piece of the puzzle. And very, very important, I believe, to know this information so that we can help people be more proactive about preventing cancer. Epigenetics is a whole field about, hey, can we feed our genes? Are our genes dirty? Dirty Genes is an amazing book that you guys can, Dr. Lynch is phenomenal. He is the expert in MTHFR. I learned everything I know from him. And that's someone you can go and follow and read the book and learn more about it for you and your family. And that's what I love about it too, is if I find a homozygous mutation in a parent, I now have information that's not only going to help their children, but their grandchildren, right? And finding out about it, the earlier you find out about it, the better, right? And so we know that the hypomethylation, again, these are studies showing direct connection with increased risk for breast cancer. So the data is out there, association. So this particular gene has a lot to do with your ability to handle folate and folic acid, which there's a bit of a difference. And we don't have time to get into detail about that, but it's really important to have healthy folate levels in patients, especially that have this gene, and to avoid folic acid, which is added to a lot of things. Toxins can be detoxified. So again, not going to get into depth. We're going to do a detox lecture next month. If you guys want to join us for that, we'll talk in depth about this, but I'm really passionate about toxins being detoxified, right? So just because they're there doesn't mean they have to stay there. We're really a lot of effective ways to get rid of toxins out of your body. Diet matters immensely. Again, we're not going to go into detail with this today, but the American diet is just sad. Standard American diet is just sad. It's processed. It's Burger King. It's McDonald's. I went out during COVID to do a home drip on a patient. There was really early on, everybody was empty. Nothing was out. Nobody was out. And I passed by Wendy's and there was literally a line down the road on Jericho Turnpike. There's got to be 25 cars sitting at Wendy's in the beginning of COVID. And I went, my gosh, this is not okay. It matters what you eat. The anti-inflammatory diet just highlights lots of leafy greens, eating organic, try to avoid the foods that are toxic like dairy and gluten, right? Not crazy hard to do. Stress is very important. We know that emotional stress plays a part in the development of cancer. We know that stress obviously reduces our immune system. We like to talk about yoga and meditation and stress relief. I think that's some of the best work we do with our patients who come in with disease, is really connecting the dots that stress was a formative reason that they got sick. And it's not the stress that kills us, right? It's our reaction. And you can always get more tools to learn how to react better to stress. So the basically what I did was, when women came in, this was the orange column is the initial, when women in the study, we did 8 active participants and 2 controls. When they came in, they all had low vitamin D below 40. And on the follow-ups, they all brought their vitamin D. Now, at that time, the recommended range was 60 to 80. Now it's 80 to 100, but they were all within that therapeutic safe range for the year after we started the research. This was sort of like my chart where I did all the befores and afters. So the first, 9 columns are the active participants, and then the last 2 columns are the control group. My control group just did vitamin D. That's all they did. They didn't do the testing. They did the thermography, and they took vitamin D. And I wanted to see the impact that only taking vitamin D would have on the breast. So all the women in the study had some varying degrees of fibrocystic density, 1 to 5. So they were somewhere between 2, 3, 4, 5. They all in their initial thermography had neovascularity, some on the right, some on the left, some on both. And that was categorized again, 1 to 5. So neovascularity, remember, is that blood vessel coming to feed the bad cells. We had thermographically suspicious thermographies on all of the women at the origin of the study. All of their vitamin D was subtherapeutic. Very rarely, I had one that was doing monthly breast exams. Every other woman admitted they had not done, that was not part of their regimen. A couple of them had biopsies. They all had subjective symptoms, which are the PMS, the breast tenderness, the cramps during their periods. I incorporated in my tracking data how long they've been on birth control, because there is data to suggest that the longer you're on birth control pills, the higher the risk of breast cancer. I also asked if they breastfed, because the longer that we breastfeed, the less risk of breast cancer. The earlier we have our first child reduces risk, as well as the number of children that you have, right? So this was all just information that I was gathering in the study, so I could kind of quantify what their risk factors were. And some had family history, some didn't, and then the age of their first child and whether or not they had the MTHFR mutation. This was the follow-up data. So we did see improvement in every single woman at the 3-month exam that then persisted to the year thermography exam. And everyone that had fibrocystic had improved, the neovascularity had improved, the thermographically suspicious patterns were gone in everybody except for the control group. And we'll talk a little bit about that. Lymphatic congestion had improved, their vitamin D level had improved, they all started doing breast exams, and their subjective symptoms, except for the control group, had dissipated. So they had no more of that PMS, breast tenderness, et cetera. And this was the kind of the before and afters, right? So you could see we've got just a lot of inflammation. This particular patient had had a very extensive family history. She had lost 2 sisters and her mother to breast cancer. She had just buried her baby sister when she came, and I enrolled her in the study. And we have these little patterns here, which is this little circular pattern here that's what we're looking for when we're looking for that neovascularity. And you could see there's just a stark difference between the before and after. Even if you look at her whole body, she had improvement because of the dietary changes. And I believe because of this awareness of stress. This woman, again, really dense breasts, notable hot spots, complete improvement in the follow-up study. This was another one that had a lot of family history, pretty stark differences in before and after, as you can see. This woman as well had a pretty extensive family history, and this would be that circular pattern that we'd be worried about. This is that neovascular pattern here, which you could see is totally dissipated in this follow-up exam. And this was one of the controls. So this was the before and after on someone who just did vitamin D. And you could see really no change at all. So they had no improvement in fibrocystic breasts. They had no improvement in lymphatic congestion. They had no improvement in the suspicious patterns. Basically, their breast didn't change at all. So I challenged thermography locations that just take pictures and don't make suggestions on lifestyle change. What is the benefit of that, right? If we don't implement something that's going to take high-risk breast and make it improve and then show you that improvement on our follow-up exam, we are not doing our jobs. And vitamin D, I was shocked when my patients didn't have any change, right? Because I know vitamin D is important. I know it's important to reduce breast cancer, to improve immune status, but it isn't enough. And a lot of times in research, you get surprised. This is the other patient that was just the control. Literally no change, not an ounce of change in this breast. And I was frankly shocked by that information. But it just goes back to, it's a part of a protocol, right? And you want to throw the kitchen sink at prevention. You don't want to skip any steps. You don't want to not have improvement. 100% of our active treatments improved. Neovascularity, fibrocystic breast, thermographically suspicious spots, vitamin D levels, and subjective hormonal symptoms. I'm telling you, when we get women to not have PMS, breast tenderness, it is not only good for the patient, it's good for the whole family, the kids, the husband, the whole family. And it's possible. Women are walking around suffering month after month for their entire lives, and it's completely unnecessary. And like I said, shocked that the vitamin D population did not have improvement. It's still super important, but it's just simply not enough. So I really dream of doing a future study where we have 100 full protocol cases and we have 100 control, so that we can get this data published and we can get thermography out there as a real tool in prevention throughout the country and get it covered by insurance. But we're working on that. So bottom line is, with the research, is you have to actively prevent the storm, right? You have to be proactive in your healthcare. You don't want to just sit around or just worry about, oh, Uncle Dan had colon cancer and I'm just going to get my colonoscopy and I'm just going to worry about it. No, make the lifestyle changes, do your own research, get a prevention partner, and get someone who's going to help you be proactive and really stay ahead of it, stay ahead of the disease. So I have this cool graphic here. Let's see if it works. Look at that. It's fancy. So I want to introduce our partners. I am super excited that we've brought in 3 new partners as thermography centers. Amanda Cini is here with us. Give us a wave, Amanda. And I'm going to let her talk a few minutes about her new practice. She's very notable on Long Island, has probably delivered most of the babies in the holistic community. And she's absolutely amazing. I couldn't be more thrilled to be partnering with her, to be able to have someone to offer holistic, women's health, and a safe place to go. Nobody looks forward to their pap smears, but I'm telling you, you're going to look forward to it with this lady. So go ahead, Amanda, tell us a little bit about your practice.
Thanks so much, Christine. I'm so excited about this. So basically, I've been a midwife for 11 years, and most of my practice has been full scope midwifery, where that includes birth and prenatal care and postpartum care, in addition to gynecology. In the last few years, I've really focused on holistic gynecology, and now I'm opening up my own office doing that. So I'm really excited about it. So holistic gynecology is going to involve all the things that you would normally do with your OBGYN, like pap smears and breast exams, like Christine talked about, cervical cancer screening, sexually transmitted infection screening. So all the normal stuff, but we're also going to do a deep dive into health and wellness, because as we all know, our health isn't just about our boobs and our vaginas, right? It's about everything. So it's about your physical wellness, your mental wellness, your diet, your exercise regimen, your sex life. All of that is part of us. And so when I became a midwife, my education focused on treating a woman as a whole person. Related to pregnancy, we didn't just focus on the baby. It was about the entire woman. And, going forward in general women's health, that's my philosophy. We are a total of all of our parts, all of the things that encompass ourselves. And so it's really important to focus on that at your annual exam, rather than just doing a breast exam and doing a pap smear. So I'm going to offer comprehensive annual exams every year where we do those things. But like I said, we're going to really take a deep dive into health and wellness at each of those. We're also going to offer hormone balancing. Like Christine talked about, a lot of us are estrogen dominant, and there's a safe way to help balance out your hormones. Usually it's through lifestyle modifications, like Christine said. Sometimes we need to use some supplements and herbs, and occasionally bioidentical hormones. There are lots of options. And like Christine spoke about as well, getting to the root cause of the problem is what we really want to focus on. We don't want to just treat the problem, right? Because obviously there's a reason why your body's out of whack, it's imbalanced. And if we can figure out why, we can help you feel well, rather than just putting a Band-Aid on the problem. Birth control, something else that we'll do. We can talk about natural like fertility awareness methods and barrier methods. We also do IUD insertions and removals. For women who want to be on birth control pills, we can do that too. What else? Management of menopause symptoms. So a lot of women come to us, in their late 40s and early 50s, and sometimes into their 60s, suffering with night sweats and hot flashes and mood swings and you name it. And that has a lot to do with hormone balancing and lifestyle modifications as well, like Christine talked about. So that's going to be another area of interest in our practice. And another area that I really want to focus on, I'm really excited about this, is offering my services to adolescent women. I remember my first GYN appointment. I was scared. I was terrified. And I feel like I'm a really relatable person, and I love connecting with my clients. And I think that young women will feel comfortable coming for their first exam. It's going to be really gentle. And to be honest, for birth control initiation, we don't even have to do a pelvic exam. That's something that's sometimes routinely done in offices, and there's really no need for it. So women can come and seek out what birth control will be best for them without having to fear that they have to have a pelvic exam. And what else? I just wrote some notes down. I'm just going to take a little peek, make sure I didn't miss anything. Our office is super cozy and warm and really inviting. And Deanna, you got to see it last week for the first time. I hope all of our clients feel the same way. I want it to be something people look forward to. So many women dread coming for their annual exam, and really, it's a nice environment. We sit, we chat. We go over all the things related to your health and wellness. And then the last few minutes of our visit will be the physical exam portion in a really gentle, calm, cozy environment. So it's something that I really want people to look forward to rather than dread, like most of us do.
Ugh, and that is so
Right?
needed. And the space is so warm and cozy. It's not cold and sterile and sitting in a waiting room. It's just, it's what a gynecological visit should be.
Right. And there's a lot of connection that goes on too. We do so much talking. It's kind of like a therapy session in addition to your annual exam.
Absolutely. We can all use that these days.
I'm a mom, I'm a woman, I'm a working mom. I have so much in common with my clients, and it's really nice to, really have the time to get to know them. Our visits are between 30 minutes and an hour. So really have the time to sit and chat and, for me to really, assess your overall health and wellness and help you make some changes.
Yay.
Yeah. And Christine, I want to let you know that I have a long family history of breast cancer. So I would love to be one of your,
Oh, my study participants. Yes. Terrific. Awesome. Yeah. So, I'm so excited for this partnership because it's like a dream come true for me to have thermography in a women's health center in such a warm, and Amanda and I are very similar in that, your environment should be cozy and comfortable. It should be like coming home. It shouldn't be like going to the doctor's office and feeling like you're a number. We treat people. And I couldn't be more excited about this partnership. I think it's going to be so great for our patients to have this collaboration of care. And I am super excited. So everybody's dropped down this website. Yes.
I'm always referring my clients to. Now they can do it right here in my office.
Exactly. Absolutely. It's so easy. So great. So we'll circulate this PowerPoint after. You guys have Amanda's contact information, and I speak from my heart wholeheartedly. She is the one to go to. You're going to absolutely adore her. And it's so needed on Long Island. It's very exciting. I'm so glad that you did this. So just to point out the other two locations that I don't think Vanessa made it on the call, Vanessa, if you did make it, just unmute yourself because I can't see you. But Cleansing Concepts is an amazing place. I probably referred a lot of you there over the years for their different services. You guys know how passionate I am about detox, and I do my girlfriend cleanse and my man up detox every year. And so I recommend sauna and colonics and foot baths and all of the things that Vanessa offers in her offices. And we're going to start out in her Garden City location to be able to offer thermography to her clients, and then also have that partnership where the patients can easily go do all their detox services. She does lymphatic treatments. So if you see lymphatic congestion on your thermography, you can go get lymphatic treatment. If you see toxicity on your thermography, you can go and get a colonic or get a far-infrared sauna. And I talk about all these services in detail during my cleanses in the videos. And so you guys, if you've done my cleanse, know about this. Like I said, next month, it'll be cleanse season soon. The spring is coming, and we'll really delve into these different services in the next webinar. But I'm super excited to be offering thermography in cleansing concepts. And so that's going to be amazing. Let's see here. I got my fancy video. Uh-oh. Okay. Like that video a lot. The third location that we opened up in is in Surrey Wellness, which is in Sound Body and Mind Yoga in Huntington, which if you've ever been there, it's just a spectacular location. They do aerial yoga, they do meditation, they do yoga classes. And Madeline and Danny are the massage therapists there. And this is their beautiful room. It is so amazing. Madeline is my personal massage therapist. I rave about her. She incorporates in Reiki and essential oils and cupping and all the different techniques that she's gathered over the years into her treatments, and they're truly therapeutic. And it's in my backyard because I live in Huntington, so it's super, super convenient for me. And Deanna's there doing thermography. And like I said, I strategically picked these partnerships because they're very synergistic with our message. They're very synergistic with our mission in integrative care, as well as being able to offer these ancillary services to our patients, right? This is about a lifestyle change. This is about learning how to detox and learning how to do yoga and learning how to do meditation and balancing out our whole team so that you really have a preventative healthcare team in your back pocket. You don't want sick care. My whole mission throughout COVID was to keep all my patients out of the hospital. It's like my mission in life is to keep you out of the hospital, right? You don't want to have to be in that sick care model. You want to do everything you can to prevent. And I am in this because I had a family member die very young of cancer. And I had this awareness as I read these holistic books, like, oh my gosh, I am doing everything wrong. I am a super stressed out type A working mom who's not eating well because she's too busy and I'm toxic and I didn't know anything about it. Right. So I started with myself, right? You start with yourself and healing yourself and everybody on our team sort of practices what they preach, right? We all kind of walk the walk. We're all on this journey together. We're all learning and we're all healing. And I think that these locations are going to be amazing for us. And I think that it's going to be such a win-win for all these small women-owned businesses. That's another big, important mission for me as well, to support each other in a sense of community. And I couldn't be more excited. And I hope you guys, the ones that are on this webinar, tell all of your friends and share this PowerPoint, and we will make the webinar available. I made sure it's recording today. We lost our last webinar. That was not good. But I wanted to get this out there, get Amanda out there, get these guys out there. Everybody's out there working really hard to bring healthcare to people, true healthcare, wellness care. And I did want to quickly just introduce, for those of you who don't know, Deanna. If you want to give me a little wave, Deanna. I'm not going to put her on the spot and make her talk because I didn't tell her that I was going to do that. But she has been just a superstar for our practice. I get these reviews from our patients, how comfortable she makes them feel, how wonderful she is about explaining things and answering their questions. And it's so helpful to me. Means so much to me to have these strong women on our team, because everybody's an extension of everybody, right? And we're just one big community taken care of. And I want you to know the beautiful face that you're going to see when you come in to get your thermography, and she's your partner. And we have a great, amazing team. These are going to be out. So we're going to send out little discounts for you guys to all the different locations. If there's a location that's close to you, and hopefully next year when we do this, we'll have double the amount of locations. So I'm going to open it up to questions, and then I'm going to stop sharing my screen so I can see the chat. Let's just see here. Chat. All right, let's see. So let's see. So we got this question emailed into us ahead of the webinar, which you can do in the future, just so you guys know. There's an option to email questions ahead. What are the best supplements for immunity before and after breast surgery to speed the healing process? It's a wonderful question. You do have to be careful with supplementation prior to surgery because It's you don't want to take anything that's a blood thinner because that's going to increase bruising. And so that's going to be things like vitamin E and fish oils. You want to stop them at least 2 weeks before your surgery. Things that are going to help wound healing are going to be zinc, selenium. Things that are going to boost your immune system are going to be your vitamin D and your vitamin C. So those are the things I usually have women on before. We do encourage vitamin drips prior to surgery. If you can come for a vitamin drip a couple of days before a surgery, it's got zinc, it's got selenium, it's got vitamin C, it's got magnesium, it's got all the things that are going to boost your immune system and help your body recover quickly. I had worked many years in a plastic surgery office, and we routinely had drips pre and post surgery, and it really improved outcomes. If women had a problem after surgery, as far as wound healing or infection, the drips definitely help them recover quickly. So that's an option for patients as well, and they are very safe to do before surgery. There's no blood thinning effects of a vitamin drip, so that's kind of something to keep in mind. A lot of women like to do the drips after just to help detox from the anesthesia. You get that punky feeling after surgery where you just feel it like it's still, kind of affecting you for a couple of days, and the vitamin drips and the glutathione will help kind of just flush out all that anesthesia. So I hope that answers your question. Why don't conventional doctors and centers use thermography to detect disease of the breast? It seems that only holistic doctors are promoting it. From what I've read, the FDA does not believe it's an effective way to screen. So it's a great question. I did talk about this a little bit at the beginning of the presentation, but I know a few of you came on later. I think one of the biggest obstacles with thermography in getting accepted universally is the fact that we catch things too early, right? So conventional medicine, we're going to look for the tumor, and then we're going to say surgery, radiation, chemotherapy, right? We see patterns. So a lot of women, if you come to me and you have a suspicious pattern, I'm going to send you to a breast surgeon to get an exam. I'm going to send you for an ultrasound. Sometimes you need an MRI. Sometimes you need a mammogram. So if we find something suspicious, there's additional tests needed to quantify the problem, right? Conventional medicine has no idea. A lot of those women will come back and say everything was fine. The MRI, the CATs, the mammogram, nobody's worried. I'm still a little bit worried because I know I have this suspicious pattern that might become a problem for you in the next 5 years. So that's where we go to work, right? We get you on the breast roll-on, we get you on the iodine, we get you on the vitamin D. We bring you back in 3 months and we make sure the pattern is gone. If the pattern is still there, I up the ante. Okay, maybe we got to get you on immune boosters. Maybe we got to look at some deeper, maybe there's level of toxicity, maybe there's leaky gut, right? We don't rest on our laurels and wait for that to become a problem, right? Whereas in conventional medicine, my training, I don't know what to do with the pre-problem. I was not taught what to do with somebody who's simmering with autoimmune disease and is 5 years away from lupus. That's where integrative medicine is its bread and butter, right? Because I know leaky gut and nutrient deficiencies and toxins are leading to that potential for lupus. And that's where all the good work happens. Lifestyle and medicine are two separate entities. Nutrition is not taught in medicine. And that's most of my cure is nutrition, right? So you have to kind of understand. And I always tell people, I come from that. So I understand it intimately. The doctors just do not have the information. We are not taught to ask, what can I do to prevent this person from having this disease? We only know what to do when it's diagnosable. So that's where you're going to see. And it's not a replacement for a mammogram. I tell women this all the time. There's a lot of women that go for thermography because they're so afraid of the radiation. They're so afraid of the mammogram, which is okay. But it's not a standalone test. You have to do breast exams. You have to do surveillance. If there's an issue, you have to do an ultrasound. So it's not something that's going to replace all the conventional treatment. It should be incorporated in to that conventional treatment because, like I said, between age 25 and 40, what do we do to help those women? What do we do? What tests do we have to show them that they might have potential for a problem at 40? Why wait till 40 and have the mass be big enough to be picked up on mammogram? That's where thermography is going to have its biggest role. And that's why you're really not going to see it in conventional medicine, because conventional medicine is not focused on preventative medicine yet. I do hope someday that the walls are come down. And I think COVID is going to be a turning point because I do think this is the first time that a national emergency has really brought to light to the fact that People have underlying conditions that they don't know about. And if they get sick with something like COVID, that they're more at risk for dying, and that the tests are not showing. People don't know that they have. Thermography is unbelievable for uncovering underlying conditions and showing people they're at risk, and then showing them what to do about it, right? So how do you take a leaky gut and heal it? And how do you take an immune system and boost it? Don't wait for the medical emergency. It's the same thing with COVID that I'm saying with cancer. Get out there and be proactive. Do a test that's going to show you that there's imbalances, or show you that you're good. Like, it's so validating to get that positive scan. I mean, Deanna can tell you, when people come in and they see that after, and they see the change that they've made in their own bodies, it's very powerful. I mean, women with a family history of breast cancer will routinely break down crying because they get to see they made a difference. There's objective proof that what they did, yes, it's hard to eat organic, and yes, it's a little bit more expensive, but they made a difference. And then they feel safer. They feel more secure. They don't feel like a ticking time bomb. It's very powerful, very empowering for women. And I feel blessed that we get to be part of those moments. Dry brushing. So dry brushing, I can circulate a video for dry brushing. There's a great little YouTube video that we have that I can send out to you guys after the webinar. But basically, the idea of dry brushing is just brush towards the heart, right? All the lymphatics run towards the heart, and they dump into the thoracic duct, and you get rid of the toxins, and you get rid of the things you need to rid the body. So you're constantly brushing towards the heart, and you can do your whole body. We focus a little bit on the breast, but you can actually do your whole body. Things like rebounding, jumping on the little trampoline, exercise, lymphatic drainage treatments, massage, they're all going to go a long way to help with lymphatic drainage, just like dry brushing. And then can you comment on anti-inflammatory effects of CBD oil? How safe is hormone replacement therapy to treat menopause symptoms? Okay, two big questions. We may not be able to really delve too deep into those, but CBD, I'm a huge fan. I believe in the anti-inflammatory properties of it. I think it's helpful topical for skin conditions and joint and arthritis, as well as internal. You have to be very careful with brand when it comes to CBD. True of all the supplement industry. It's the Wild West. There's no regulation. You can put whatever you want in these things, good and bad. You have to get trusted brands that have been tested. CBD is, forget it. Everybody wants to make a buck in CBD these days. There's a lot of brands out there that don't even have any CBD in the product, right? So, and they're contaminated. So you need good third-party tested, grown in a greenhouse to assure that it's organic. Really important with the CBD, but I'm a huge believer in good quality CBD. And then yes, hormone replacement therapy in menopause is very protective for women. It's very therapeutic. It's about, Amanda and I have very similar takes on this, in that we want to balance out the underlying imbalances, get you as good as you can, use the bioidentical hormones to, kind of help you deal with the symptoms while we do the work and we get you better, right? So that you're more balanced. Women that have very difficult menopause, in my experience, are very toxic. They're the same women that have a lot of toxins. And, you can have one woman, she gets warm a few times and her period stops. And then you have another woman who's 30 hot flashes an hour, drenching sweats at night, and she wants to kill her husband because he didn't change the toilet paper roll, right? There's a big spectrum of menopausal symptoms. Those women that have the worst symptoms are typically pretty toxic. And so that's part of the underlying causes that we work on. But the bioidenticals can be life-changing for women, right? They can be very protective from a breast standpoint. They can be very helpful in many different ways. So, I think done properly with bioidenticals, and then also treating the underlying imbalances, is really, really helpful when it comes to menopausal symptoms. I just want to make sure if there's any other pressing questions that anybody has, if they want to just unmute themselves, they can ask. Like I said, I will circulate this presentation. We'll put it on our blog, on our website. Maybe Betsy, can you drop the website in the chat for me? We do have our ability to online book for your thermographies on our website, as well as our store, which you can buy your breast roll-ons, your iodine, all that good stuff. And like I said, we're going to be doing thermographies. People didn't do them for a year because of COVID. And I have these girls every chance I can getting on the phone and calling people, because I'm worried that people miss their 3-month follow-up. They miss their 6-month follow-up. They miss their annual. And it's safe now. We're very safe. Everybody has masks. We have a virtual waiting room. I know Amanda does too, where you wait in your car. We bring in one patient at a time. It is safe to go out now, and it is safe to get your screening exams and get out there and get your pap smears and get your thermographies and share this information with other women, because that's really how we're going to get the message out. It's grassroots, women taking care of women and women taking care of their families. So if you guys don't have any more questions, I want to thank everybody for coming. Thank Amanda for coming on and telling all the patients about you. I'm so excited to work together. Thank you, Deanna, for being such a superstar. And again, if you have questions you're not comfortable asking in public, you can always shoot an email to us at info@getintegrativehealth.com, and we will get back to you. So thank you guys so much for being here. Keep an eye out. We're going to do our next webinar on detox next month. So we can, as soon as I feel like spring is coming, like it's close, right? We can't detox till it's warm out. And I feel like we're getting touches of spring. It's going to be early this year. I can feel it. So thank you guys so much for being here. Really appreciate it. And I hope you all have an amazing weekend.
Thank you so much.
Oh, thank you guys.